Hi, I'm Dr. Matthew Samra. I'm a vascular surgeon. I work at the Vascular Institute. For college, I went to the William Patterson College. I grew up in northern New Jersey, and I always wanted to be a physician since I was about 3 years old. I was fortunate enough to be accepted to medical school during a very competitive year. I went to the Kirksville College of Osteopathic Medicine, which is now A.T. Still University. I wouldn't trade the time that I had in the Midwest or in Phoenix, Arizona, where I spent my third and fourth years, for anything. It was just such a nice change from growing up in New Jersey to experience something else. Wyckoff Heights Medical Center is where I did my general surgery residency. It was probably 5 of the most eye-opening and greatest years of my life. I was fortunate enough to do about 5 or 6 months at Memorial Sloan Kettering, learning about all cutting-edge cancer treatments, and with some of the greatest surgeons. Being a chief at Wyckoff Heights meant that you basically were taking care of about 12 or 13 surgery residents plus about 50 medical students. It teaches you organization, it teaches you leadership, and it really kind of sets you up for what you're going to be for the rest of your life. I did do 2 fellowships, one in cardiothoracic surgery and then the second one in vascular surgery. I always loved the cardiopulmonary system. I love the heart, I love the blood vessels. I really wanted to learn and to get as good as a surgeon as I possibly could, so I didn't leave any stone unturned for ultimate patient care. I was very fortunate when I graduated my fellowship to become director of the Deborah Center for Venous Disease, which gave me a lot of experience treating veins, which obviously a lot of our practice is done doing that to this day. I was also fortunate enough to train a huge number of young vascular surgeons and general surgeons and medical students in our training program, which was the residency program for vascular surgery at Deborah. So I joined the Vascular Institute a little more now than 5 years ago. I've been fortunate enough to be part of the best, and for my money, it's one of the best multi-specialty vascular groups in the world. We do cutting-edge treatments, and we have so many wonderful specialists who are just top of their field, and I'm fortunate enough to be part of it. When I was doing my general surgery residency, I really fell in love with becoming a vascular surgeon. I fell in love with the idea. The patients are, for the most part, a little older, and they're just really appreciative of the care that you give them. If somebody comes in with pain in their leg or an aneurysm or carotid artery disease or whatever the problem is, you treat them, they just appreciate what you did for them, and I just really fell in love with the population. My current and future patients all know by a person that the care I give them would be the exact same care that I would give my mom, my dad, my kids, my wife, it doesn't matter. So when they come to see me, they are seen by a top-notch, well-trained nurse who does the intake. They then come to see me directly, and I do a full physical exam. I sit there, I listen to the issues, I speak to their primary care physician, I make sure that there's full communication, and the patient will leave my office knowing what I think about what's going on with them and a plan of care. And that happens 100% of the time. I want to thank you for your attention and for watching this video. For more information, don't hesitate to either reach out to our main office, which you can find at our website, www.vi-ami.com.